In a landmark moment in the fight against the coronavirus pandemic, the UK medicines regulator has approved the coronavirus vaccine developed by AstraZeneca and scientists at Oxford University. The first doses are due to be given on Monday. It's the second vaccine to be approved in the UK after Pfizer-BioNTech was given the green light earlier this month. It's also been announced that the immunisation campaign will now shift to giving as many people as possible their first dose of the vaccine, with a gap of up to 12 weeks before the second dose is administered. The UK has 100 million doses of the Oxford-AstraZeneca vaccine on order. That's enough for 50 million people. Compared to other vaccines being developed, it's cheap, easy to produce and can be stored in a fridge. Since being designed in April, it's been through large-scale clinical trials involving thousands of volunteers. The boss of AstraZeneca said it was an important day for millions of people in the UK and said his company would not profit from supplying the vaccine. Prime Minister Boris Johnson said the approval was fantastic news and a triumph for British science, saying we will move to vaccinate as many people as quickly as possible. The immunisation programme will begin next week on January the 4th. The Health Secretary Matt Hancock said it was a really significant moment in the fight against coronavirus.
The vaccine is the way out, and the approval of the Oxford-AstraZeneca vaccine it brings forward the date at which we're going to bring this pandemic to an end. And so it's good news for everybody watching and the whole country. This is a real British success story. It's a combination of the science at Oxford University and the UK Vaccines Network, the government funding through the National Institute of Health Research, who've done an absolutely brilliant job, obviously AstraZeneca and the NHS. And so this is really good news this morning that the vaccine's not just been approved, but also that they find that the immunity to the disease comes after around a fortnight after the first dose, which means that we can really accelerate the number of people who get protected.
Well, speaking during a data briefing at Downing Street earlier, the chair of the Human Medicine Expert Working Group explained how the doses of the vaccine will be administered.
What we are approving is that 2 standard doses should be given. They should be given at an interval of between 4 to 12 weeks, i.e. that there should be an interval of 4 to 12 weeks between the first and second dose. We also looked at the half-dose regimen, which has been publicized quite widely, but we felt that the results were not borne out by the full analysis. We've come to the decision of an interval of between 4 to 12 weeks based on the data that was presented to us. Because of the design of the trial, some people got second doses at different time intervals. This allowed an analysis of the effectiveness of vaccine if you were to be able to delay between 4 to 12 weeks. This showed that the effectiveness was high, up to 80%, when there was a 3-month interval between first and second doses, which is the reason for our recommendation.
Well, the chair of the Joint Committee on Vaccines and Immunisations explained what the data showed regarding the efficacy of the vaccine.
The data shared with us, and I'm not sure is entirely in the public domain, calculated the vaccine efficacy between day 22 of dose 1 to the time of dose 2 being given. And the figure is around 70%.
Well, we can cross now to Oxford and speak to Sarah Gilbert, a professor of vaccinology at the university. And Sarah Gilbert was the lead researcher of the team who developed the vaccine. Good afternoon to you, Professor Gilbert. People around the country are saying that this is a great day, but for you particularly, there must be enormous satisfaction at the approval of this vaccine.
Good afternoon. Yes, it's a great day. We're very proud, all of us here in Oxford, the team who've been working on this vaccine from almost exactly a year ago, adding to our team with partners in multiple sites around the UK and then around the world to bring together this data set that the MHRA have now assessed to give approval. We're very proud of this achievement.
So just explain to us how it is that you have managed in the space of a year to do something that would normally take years to do.
It's been possible because we've been planning to do something like this for quite a long time. We've been working on ways to develop vaccines that mean we can go quickly when we need to make a new one. We've been using this type of technology for many years now in Oxford to develop vaccines against other pathogens that can cause outbreaks, but we've never had to work as quickly as we have done this year. It's really been very challenging, but we've had a great team of people and partners working with us, and in particular AstraZeneca taking over the manufacturing of the vaccine, which has gone so well and has meant that so many doses will be available both now and in the coming year.
There are lots of questions being asked about this vaccine and the new variant of coronavirus that's emerged and that's spreading so quickly. Are you confident that this vaccine can deal with that new variant?
Well, so far we haven't seen any evidence that any of the vaccines will be affected by the emergence of these new variants. There's one that's been picked up in the UK, another one in South Africa, and they have some similarities. They appear to be much more transmissible, but that's the main difference between them and the original version. We are not complacent, though. We recognise that as the virus spreads through a population, it will mutate, and there are likely to be more mutations in the future. So we've already started getting our plans into place to be able to produce a new version of the vaccine should we need it in the future, but we don't think that that moment has come yet.
We heard from experts advising the government a little earlier in the morning about the doses of the vaccine and the length of time between the first dose and the second dose. And there seem to have been developments on both of those counts. Can you just talk us through that?
Yes, we've been able to provide data from our clinical trials on a variety of intervals between the first and the second dose, because people didn't all get the second dose at 4 weeks. Some of them had it at intervals of up to 26 weeks, but the data is most robust looking at an interval of up to 12 weeks. And in the situation we now find ourselves in, with the pandemic raging, case numbers increasing rapidly day by day, and a real need to get as many people protected as possible, it's been decided by the JCVI that the most pragmatic thing to do is to give as many at-risk people as possible the first dose of the vaccine, because we know that from 3 weeks after that first dose, there's a very good level of protection, and nobody in the clinical trials at that point after their first dose was in hospital with COVID or experienced severe disease. And being able to prevent people going into hospital with COVID is going to have a massive impact on the health service. And so that's been the recommendation, that people should be given their first dose, and then they have up to 3 months to receive the second dose. And the second dose is still important because that's going to give us the durability of protection to take people through the rest of the year and give them longer term protection, whereas the first dose will give fairly rapid onset of protection, but not for such a long time.
But that is key, what you said, that with the first dose it prevents hospitalisation and serious onset of the disease. And so it turns coronavirus into a milder illness, even if people are ill, but into a milder illness that doesn't then threaten to overwhelm the health service.
Yes, that's a really important finding, that we can prevent severe disease with one dose, and that's what we're now hoping to be able to do in the first instance.
And just to clear up, the efficiency of that first dose is what exactly?
Well, as was reported this morning, in the short term, the efficacy of the first dose from 3 weeks after vaccination is 70%, but that is short-term protection, and it's necessary to have a second dose in order to get the longer-term protection.
OK, that's all very clear. Thank you very much indeed. Professor Sarah Gilbert there from Oxford University.
Thank you.
Well, listening to that was our science correspondent, Rebecca Mortimer. Rebecca, I mean, a big day for Oxford University, of course, and particularly for Sarah Gilbert and her team.
Yeah, an enormous day. And it really is kind of a turning point for the pandemic here in the UK, because what this can really do is speed up mass vaccination. I mean, the thing that the Oxford-AstraZeneca jab has going for it is we've ordered a lot of doses, 100 million doses. That's enough to vaccinate the whole of the UK population. And also storage is much easier than the Pfizer vaccine. That needs ultra low storage, which has issues with transport, with getting it to places like care homes. The Oxford vaccine it can be kept in a normal refrigerator, and that makes rollout of it much easier for for it to happen all around the country. So, you know, this is a big day. And the price too. I mean, the price is important. It's a cheaper vaccine, which globally is going to be really important too, and getting it to lower and middle income countries also. And of course, you know, vaccination is not just about vaccinating one country. You have to vaccinate everyone everywhere. That's the only way you can really bring this pandemic to a close.
During the data briefing that we were hearing a little bit earlier, of course, all the focus today is on the AstraZeneca Oxford vaccine, but there was updated guidance on the other vaccine that's already been in use now in the UK, the Pfizer-BioNTech one.
Yeah, that's true as well. So now the intervals changed for the Pfizer vaccine too, because initially that's a 2-dose vaccine also, and initially the plan was to give the 2 doses with 21 days in between the first and the second dose. And the first people who started getting their vaccination, the over 85, some of them are now getting their second dose. But today they said that the second jab has to be given 21 days or afterwards, so the length is increasing. And again, it's this idea to get as many people vaccinated as quickly as possible, because again, for the Pfizer vaccine, it's been shown that one jab after a certain number of days, 21 days, does infer good protection. So I mean, it really is a pragmatic decision, this. I mean, you've seen what's happening with the numbers in the UK. They're going up very quickly because of this new variant. People who are vulnerable are going to be vulnerable to this too. So if you can get them vaccinated and you can offer them some protection, that's really important. So that's now happening with both the Pfizer vaccine, which is already being rolled out, and the soon to be rolled out AstraZeneca Oxford vaccine too.
And worth pointing out, Rebecca, that there was some updated guidance on the use of the Pfizer vaccine for breastfeeding women.
Yeah, that's right. Pregnant and breastfeeding women. So before now, it wasn't recommended to be given to women who are pregnant or breastfeeding. And now they've said you should have a talk to your doctor. You can have it, but you need to understand the risk and benefits of doing so. Also, people with allergies too. So the advice on that has slightly changed. So if anyone's allergic to the ingredients in both of the vaccines, they shouldn't have the vaccination. But if they have other allergies, say food allergies or allergies to other medicines, it's probably okay to have the vaccination. But of course, they should talk to the healthcare practitioner who's giving them the vaccine first, and those questions will be asked. So slight changes there for both vaccines.
OK, many thanks. Our science correspondent Rebecca Mortimer there. Well, we can speak now to Andrew Preston, who's a microbiologist at Bath University who focuses on infectious diseases. Good afternoon to you. So the new vaccine, the Oxford-AstraZeneca vaccine, to be rolled out in the UK starting from next week. But it's going to take time, isn't it? And we have to remember that as a population.
Oh, absolutely. The numbers involved are obviously incredibly large. So, you know, some people said end of February for starting to be able to sort of get back to normal. I think that's very ambitious. Easter for others. There will be probably some hiccups along the way. But I think the really key thing is this is the start of the way back to normalcy. We need to focus on that longer term sort of landscape, sort of maybe summertime.
Interesting you say there might be some hiccups on the way. I mean, this is a time of such positive news today, isn't it? But it's probably best to be cautious. Just talk us through what hiccups might there be.
Well, clearly the sort of demand is going to outstrip supply for at least the immediate future. There's going to be clearly at the population level some reports of adverse reactions to the vaccines that's going to cause concern. Clearly, there are still some questions that need to be answered, particularly in terms of the effect of the vaccine on possible transmission. And we're still waiting for the full trial data on the exact level of efficacy for the older age groups, for those over 65. But clearly, with as Rebecca said, with the transmission raging at the moment, and the NHS very close to collapse, these are vaccines that can stop people from becoming sick. So this is a really, really key intervention, the first real intervention that we've had in this pandemic.
And what proportion of the population needs to be vaccinated for it to have full efficacy?
Again, that depends really largely on the effect on transmission. So when we talk about herd immunity, that's really making the assumption that the vaccine will actually then not only protect the individual, but stop those people from picking up the virus and passing it on to others. Under those circumstances, you can have a relatively lower proportion of the population vaccinated, but still protect those that have not yet received the vaccine or don't, or not going to have it. Without that sort of break on transmission, then we're really looking at having to vaccinate really more or less everybody to protect each individual from that risk of severe COVID.
And it is a logistical exercise now, isn't it, and a challenge to get it out there?
Absolutely. We've not tried anything on this scale before, but has been well discussed now with the Oxford vaccine, with its relatively easy storage sort of regime. This really now switches us to be able to sort of take the vaccine to the people, if you will, as opposed to the Pfizer one with the very low temperature requirements, really meant bringing people to sort of the well-equipped medical centres. This really does sort of mark a step change in the rollout of the vaccines.
We know that the Health Secretary, Matt Hancock, is going to announce more restrictions in England because of the new COVID-19 variant. Where do you stand on the level of restrictions that people are under now? Do you think they should be extended? Do you think that the toughest restrictions should be tougher?
I guess the concern is that we have some pretty harsh restrictions in place, but the data, 53,000 cases yesterday, suggests that either those restrictions are not tough enough or, unfortunately, they need to be extended. So if the focus is on about trying to protect the NHS, stop it from becoming overwhelmed, and, of course, saving the lives of people who, unfortunately, are going to die, and we see hundreds still dying each day from COVID-19, then I'm afraid probably we're going to see an extension of restrictions and maybe even toughening those even in tier 4 areas if the data is suggesting we still have unchecked transmission. That's just sort of a response to the actual sort of situation on the ground, as it were. So whilst I don't think anyone's in favour of restrictions, it may be the only response we have whilst we get these vaccines into the arms of as many people as possible.
OK, thank you very much. That's Andrew Preston from Bath University. Thank you.